You should see a red dot in the corner soon if you do not already. Let's see, just a few more stragglers. Okay. Hello and welcome everyone to the May 2021 Fresh School Health and Nutrition webinar. I'm your host, Salome Asris from Save the Children. A brief introduction about FRESH is that it's an interagency partnership for school health and development in low and middle income contexts. It's a community of researchers and practitioners and policymakers in education and health, and we host webinars on topics related to children's health and well-being. Usually we commemorate an international day, and this month we are commemorating Menstrual Hygiene Day, which has been celebrated on May 28th since 2014 to highlight the importance of good menstrual health and hygiene and raise awareness around the challenges that girls and women face at a global level. It was initiated by the German NGO WASH United, and we are fortunate today to have a representative from WASH United as a speaker. I usually provide an update around the theme of the commemorating day, but as it will be discussed during the presentation, I will skip this portion today and go straight into the introductions of our wonderful speakers. Our first speaker is Thérèse Mahon. She is the co-coordinator of the Global Menstrual Collective and Regional Programs Manager of the South Asia region at WaterAid. She has been working on menstrual hygiene, health and hygiene for over 15 years and has made significant contributions specifically into building the evidence base around rigorous documentation of development practices relating to menstrual health and hygiene. Welcome, Thérèse. Our second speaker is Ina Jurga, and she's the head of WASH United's education program and serves as the international coordinator for the Menstrual Hygiene Day. She also has more than 15 years of professional experience in water sanitation and hygiene, starting out initially as a sanitation expert and most recently focusing on menstrual health and hygiene. She would like us to know that she's passionate about gender equality and collective impact, and we are very excited to hear from her on what we can expect from Menstrual Hygiene Day 2021. Welcome again to both our speakers. Just a friendly reminder before we start to please keep yourself on mute throughout the presentation. And if throughout the presentation you have any questions, please type them into the chat box that we'll be monitoring. Once the presentations are over, we will have a Q&A section pulling from the chat box as well as from the general audience. Thank you so much for your cooperation. Over to you, Thérèse.
Thanks very much, and thanks also for inviting us to be here for this Fresh Network webinar. It's really fantastic to see a number of people. It's really yes, no problem. It's really great to be on this webinar, and also to see amongst the participants a few people who I've not connected with for a while. So really looking forward to our discussion following this presentation as well. And just to open, I think it's really a critical time for us to discuss this topic. Not only is it timely because of Menstrual Hygiene Day coming up at the end of the month, but as I'm sure everyone on the call is aware, we have seen how the negative impacts of the COVID pandemic have really impacted badly on gains made towards gender equality. And, you know, agencies like UN Women have really highlighted that, in that gender gains over the last 10 years are really sort of starting to be rolled back and are at threat of reversing further. And I think, you know, we can see how the pandemic has impacted that by looking at themes like menstrual health and hygiene and school health. And it was an area where we saw significant leadership and, you know, pioneering approaches towards addressing menstrual health and hygiene in school settings and with adolescent populations through WASH in schools, through integration into comprehensive sexuality education, etc. But due to the pandemic, schools have been closed for a long time. Schools that were providing access to supplies of sanitary pads for girls have closed down. And of course, the support and education programs that were being provided through education settings, and also then creating this increased risk of child marriages, of early pregnancy and so on, and those negative impacts, I think, are still, to be seen. So it's really important, I think, that we consider the importance of menstrual health and hygiene as part of a package to get gender back on track, and to address, the safe reopening of schools in a gender equal way, and to build community pandemic resilience going forward. And so this webinar, I think, is a really great opportunity for us to consider what's the role of school health actors in that, including those from WASH, education, sexual reproductive health. Next slide. So in terms of what we wanted to cover today was just to really share a few initiatives that can contribute to this and opportunities for collaboration. And so we're going to share on the Global Menstrual Collective, a brief introduction for those of you that haven't been engaged with the collective so far. Also a piece of work done by a collection of partners and members of the collective to make the case for more investment in menstrual health and hygiene that Ina was involved in and will present. And we also have a new definition of menstrual health that's just been published. So I'll share a little bit on that and how that can be used across sectors for policy, practice and research. And finally, Ina will also update on the plans for Menstrual Hygiene Day this year and how people can get involved and contribute. Thanks. Yeah, next slide. Thank you. So the Global Menstrual Collective, for those of you who have not heard about it, it's a relatively new collaborative network that was established in 2019 through a co-creation meeting that was hosted by the Water Supply and Sanitation Collaborative Council in Geneva. And it brought together a whole load of different stakeholders who'd been involved in menstrual health and hygiene, from academic institutions, UN agencies, INGOs, and other collaborative platforms. And we really came together because, there's been such a huge increase in awareness of menstrual health and hygiene, and a lot more attention being made to the issue. And yet there wasn't any kind of collaborative advocacy platform at a global level. But the first thing that we were looking at in the meeting was to sort of say, well, what would be the added value of this? What is the one area where collective action beyond what's already seen through a number of other initiatives like MH Day, what are the areas where further attention, further collective action is really needed? And what those at the meeting identified as like a really critical gap was that there is really insufficient investment being made in menstrual health and hygiene, despite the attention that the issue has now been given. So that was identified as an area where people felt it was worth coming together to put further attention. And we've recently completed a strategic planning process, and the vision, mission and goal here sort of reaffirm our work together now going forward. So our vision is of a world where all people who menstruate are equally able to attain the highest possible level of menstrual health and manage menstrual hygiene safely and sustainably with dignity and without stigma. Our mission is to use our collective strength to drive and guide investment based on evidence. And our main goal is really around increased and sustained investment and expenditure from all stakeholders responsible for delivering menstrual health and hygiene. Next slide, please. So in terms of our theory of change, it's really that we see this collective action could help accelerate progress on menstrual health and hygiene by applying this sort of persistent pressure. And our focus is really on integrating menstrual health and hygiene into relevant policies, programs, services and budgets, and particularly looking at platforms like the SDGs. So not so much like as a standalone, but really through integrating menstrual health and hygiene and using our collective strength to push that forward. Next slide. And in terms of how we are working, just in terms, first of all, of how we're organized, we have a steering group, which is the kind of strategic planning and governance body. And then our activities are undertaken through action groups and task groups formed of different members coming together. And also we encourage members to work together sort of in collaboration with the collective, but sort of semi-independently of us through initiatives that they themselves identify, but which align with our purpose and which can be leveraged by other members within the collective. And the investment case that Ina will present is a great example of that. So we're really working towards collective advocacy around particular platforms and processes. So in the current year, one of the processes that we're targeting is the Generation Equality Platform. We're also looking to develop briefings and materials to support the integration of MHH within the Sustainable Development Goals. In terms of evidence generation and identifying gaps, there's a research action group which has been undertaking a comprehensive consultation with stakeholders to identify what their evidence needs are, and then we will be advocating for those gaps to be filled through investment. And also this year, we're looking at scoping out how, what is the private sector role and how does the collective engage with the private sector, and building on our organisational development. I think, next slide. Yes, that's handing over to Ina. So this is really a great example, as I said, of an initiative that we are seeking to leverage and build on in our work going forward. Ina.
Thank you, Therese. I hope everyone can hear me loud and clear. Yeah, as Therese mentioned, this investment case is done in collaboration with the Global Menstrual Collective by a group of partners consisting of PSI Europe, Simavi, The Case for Her, and Wash United, who are all members of the Global Menstrual Collective. It was that we drove this forward, but we saw definitely bigger opportunity and leverage factor to do this instead of alone, in collaboration with the Global Menstrual Collective and its purpose. I have a bit of time, maybe some of you have seen the case, but why we've done it was really a framework setting out why and how to fund and invest in MHH. As Therese also mentioned, funding into menstrual health and hygiene is really a critical gap and has not followed adequately to the progress we made and all the ambitions that we have in addressing the issue for all women and girls. So when we looked at this investment case, we wanted to look at the progress and gaps in funding and programming, and linking the investment between the global, national, country and community level and the different sectors. The target is for this paper is really existing and tentative funders and investors. But of course, because it's a framework, it also helps other stakeholders in coordinating their programming and then also discussing it with their donors and funders. Next slide. So the investment case is actually like a little bit triangulate. What we did is making the case why to invest. And I don't want to reiterate because I think you're all familiar on the reasons why to invest, because of dignity, privacy, health, gender equality, education, and as a matter of human rights. So the why to invest I left out. We triangulated that with the current state of investment, and also to gain a little bit understanding on why donors invest or why they're not yet investing. So for the current state of investment, what we found is that, yeah, funding was really marginal. There's only a small number of donors, and it's often part of a larger investment in related sectors, so especially in WASH or under health. However, and that meant that also the investment has been put mostly into silos, and here WASH and education were leading, as well as a lot of funding went into product distributions or access to products. Overall, we found it was really difficult to track the MHM funding streams, which in turn makes it difficult to hold funders accountable. But this is really something, because we found it out, we also put this forward to the Global Menstrual Collective to take this up. And really, in the new strategic plan, this is also something that the Global Menstrual Collective will do, is really get the teeth into tracking funding streams, because without knowing what's spent, it's really difficult to also advocate for a little bit more. Why donors invest, I didn't put this out, but I recommend to read the report, where we have different statements of current investors to understand what drives them. And I can only say that it's very, very diverse, the reasons why they invest. So there's no uniform answer. Next slide. This is maybe more interesting for you, because that's also speaking to a programmatic approach. So the how to invest. So for us, it was really important to say that the issue is cross and multi-sectoral. And with that, of course, comes their own specific challenges. But I think for us, it's really clear, even if investment is made into one sector, the others need to be considered in order to achieve a holistic approach. And therefore, this framework aims to guide that, how the different areas, meaning the products, the information, services, norms, and infrastructure are related, who's taking the lead there, and also that, taking the lead there. This needs to be supported by research and innovation, and I speak to that, and policy support. And next to cross and multi-sectoral, the next principle on how to invest is to leave no one behind. Even if we make progress, I think you agree that there are women and girls and people who menstruate that are not equally targeted, meaning women and girls living in humanitarian settings, with disabilities, transgender person, or because of geographical area. So I think that is a principle that speaks dear to everyone. A rights-based approach is very similar and overlapping with this, but by situating menstrual health and hygiene in relation to the different human rights, like human rights to health, education, WASH, that really helps to drive the arguments. And this is actually what we found is speaking to a lot of donors. Evidence-based, a fourth principle that also is underscored by the Global Menstrual Collective as one of the key principles, I think is clear. And within the FRESH group here, I think you're also supporting to build the evidence. So again, I do think they're working strongly on this. And the last principle is that any approach or any investment program needs to be context specific. What we really saw is that it can differ widely between urban, rural, between geographies, social norms, and so on. So there's, again, no cookie cutter approach to that. I guess you probably agree with all those principles. Next slide. So that's actually my last. I recommend you to download and read the investment case. So here is, I pulled out some of the recommendations. What I wanted to mention is that this investment case, while these five organizations were leading the program, we held consultation rounds with donors, but also with other relevant stakeholders in different regions across the world to come up with those recommendations. So this is not only ours, but we feel these recommendations are grounded in practitioners' experiences. So we have clustered 3 recommendations. So we see MHH is an opportunity, but we need to increase evidence. And under this, one point is to use a common and clearly defined metrics, indicators, and quality standards. And I think, as you maybe saw, UNICEF released MHH monitor M&E framework, a toolkit kind of, or a guide. And also the JMP is starting to increase increasingly data on MHH. So this definitely helps. Under the second recommendation, to emphasize that MHH is a cross-sectoral issue, is really to use the investment framework to make context-specific analysis and make informed decisions. And the last one is that MHH requires coordination. And here we're so happy that we work with the Global Menstrual Collective, which is of course a coordination group in itself, but it's also coordinating with other groups such as this group or groups within the education sector or other conferences to really strengthen advocacy. We really, as I said before, promote funding, tracking funding, and hold donors accountable, and strengthen international as well national coordinating mechanisms. That's for it. And I see Jackie had a question. What type of donors did you reach out to? Individuals, governments, corporate donors, and foundations. So it was a mix of government donors and foundations. Mostly both. We do see there's a role for corporate donors, other types of investment instead of like the classical bilateral or multilateral funding. So different investment. We just went the classical way to look at government funding and foundation funding. Corporate donors, we included where they invest, but we did we invite them to the consultations? I wasn't so sure if, not so sure, but we also see this is just a start, and it's definitely complemented then in the future by tracking funding, by a piece on other kind of investment mechanisms or more innovative ways of funding. So yeah, we see this as a really only as a starting paper for more to do in this area.
Thanks, Ina. So I'm just going to share now as well a complementary, I think, to what Ina just shared, initiative, which has just been published, which is a definition of menstrual health. And this was developed by an action group within the Global Menstrual Collective called the Terminology Action Group. And it's set out through a consultative process to bring a new definition of menstrual health. And the reason for this is really that a lot of actors have started using the term menstrual health as a broader term to bring in other aspects related to menstrual experiences that need to be addressed, but it hasn't been formally defined. There was no kind of consistent self-contained definition. And I think definitions are quite important because they bring a coherence and consistency to the way in which terms are used that can be very useful for policy practice and research. And it's important then that such definitions are really grounded in experience and grounded in evidence. So that's what we set out to do, and definitely building on existing definitions, both in the menstrual field, so looking at the definitions of menstrual hygiene management that has really stood the test of time, but is perhaps a more narrow definition. And also definitions of menstrual health and hygiene as well, which look at some of those more systemic elements and the enabling environment. But we also wanted a definition that was aligned to other definitions of health. So I'll come on to that. So our definition was, developed with these three notions in mind that we felt it would help ensure that menstrual health is prioritized as a unified objective that could be used in global health, national policy and funding. That it would address the breadth of menstrual health. So a lot of research in the past few years has really expanded our understanding of the range of menstrual related experiences and requirements of people who menstruate. And not all of that is only limited to managing menstrual bleeding, but there are other issues around the menstrual cycle, including menstrual disorders, including psychosocial impacts that are related to other times in the menstrual cycle, not just menstruation itself, for example. And like I say, to have this shared vocabulary that people can use consistently and through which we can make progress. Next slide. So the definition is incredibly simple, and it's built on the WHO definition of health, but it establishes menstrual health as an area of health in its own right, and not just a part of other types of health. So menstrual health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity in relation to the menstrual cycle. And this definition and discussion paper has been published in Sexual and Reproductive Health Matters journal, and the citation and co-authors are named there on the slide. Next, please. So the definition also sets out what are the requirements for achieving or attaining menstrual health. And so we can see here actually a lot of alignment with the framework that Ina shared. And these two pieces were kind of being developed concurrently. And so, you can see here, first of all, the importance in setting out this definition. We wanted it to recognize a life course approach and also to be gender inclusive. So although, the majority of people who experience a menstrual cycle are women and girls, we also wanted to acknowledge within the definition that there are other people who also experience a menstrual cycle, and this definition equally applies to them. And these key areas that need to be addressed are information, which is information about the menstrual cycle, but also about care and hygiene practices, access and use of materials, facilities and services to care for the body that are safe, that are hygienic and private, and also respond to people's preferences as far as possible. And then this health services for the diagnosis, care and treatment of menstrual discomforts and disorders. The the importance of a positive and respectful environment in relation to menstrual cycle free from stigma, and that includes as well the resources for that environment to really be enabling. And finally, the freedom to participate in all spheres of life, free from menstrual related exclusion. And that's really more that's about the freedom to participate if someone chooses to. I think that was another important consideration. Next slide, please. So we have a number of questions. Before I go on to that, which we thought people could think about while we give the update on Menstrual Hygiene Day, but just to conclude on the definition. You know, we really see that this definition can be applied within research to inform monitoring, to inform funding mechanisms and proposals, but really to encourage the different sectors responsible for addressing those services to identify what their roles are and to improve coordination in order to comprehensively address the menstrual needs of people who menstruate. So yeah, a couple of questions for just thinking about as well, because we'd like to hear from those on the webinar how we can best make this case for investment across sectors. What are your ideas, and what are some of the key advocacy opportunities for us to address it, particularly within the school health and education sector, to scale up menstrual health and hygiene towards achieving gender equality and SDGs. But I'll leave those with you to think about and hand back to Ina to give an update on plans for Menstrual Hygiene Day.
Thank you, Therese. Yes, I think when it always gets me thinking. So when we started Menstrual Hygiene Day back in 2014, that menstrual hygiene or menstrual hygiene management was the key terminology around there. So we keep with the name or brand Menstrual Hygiene Day, but we increasingly then use in the description menstrual health and hygiene. So if you prefer to use the term menstrual health, all we want to ask you is to keep the name Menstrual Hygiene Day, because it's a name, or use the abbreviation MHD, and then you can use any term you like that fits to the work that you're doing best. So with that, I'm really excited, and really thanks to the Fresh group to give me personally the opportunity to present today. We're a little bit more than 2 weeks away, and we're extremely busy, but you probably too with your planning. So without further ado, I want to give you some small snapshots what you can expect. Next slide. So the main theme for this year, completely in line what we just talked about, is more action and investment in menstrual health and hygiene now. So what we always do is we choose a very, very broad theme that is not necessarily focused on a sub-theme of menstrual health and hygiene. So in order for you to link to the main theme, whatever issue or in whatever context you work in, what is most relevant. So that could be education for you, but that could also be talking about periods and pandemic still, or even periods post-pandemic. So that's all possible. The main hashtags for this year are MHD 2021 and It's Time for Action. And all I ask to you is always to speak with one common voice, because the louder and more clearly our message is, we all be heard. It's like a choir that we do every year on 28 May. Next slide. And here is our free campaign material that we just released today well, like last night. We have 6 amazing artists this year, which created social media materials that you can use. English is ready, other languages, French, Spanish, Portuguese, German, Hindi will be ready on 13th. And I will copy the link into the board. It's always related to the main theme, but then also sub-themes, for example, education, like on the top left. So if you want to do that. In addition, we are having another infographic this year, which will be the roadmap to 2030, also with the call for more investment. Otherwise, we'll never make it to the top. This is currently in progress, and I think it will be ready by end of this week or early next week. Just to reiterate, every year, all the materials can be co-branded with your logo and any other amount of partner logos. So to really make it yours, and yeah, they're freely available. Next slide. Another key element of the campaign, and many of you have maybe seen it, or you can even see it with our adapted logo on the top right, is the menstruation bracelet, which we really would establish as a global symbol for menstruation. And it's really, I want to emphasize this, it's like the red ribbon for HIV/AIDS that you wear every year on World AIDS Day, and also on any other day. It's really not a one year off campaign element. It will be a continuous element that really shows our commitment to the cause. And the person who's wearing the bracelet is really showing that periods are nothing to hide and help to end period stigma in a beautiful way. It consists of 28 elements, of which 5 are red or maybe pink. Next slide. But the bracelet doesn't have to be the beads. They can really be made of any of your materials that you have available. And that's really the beauty of it. And we've saw so many creative examples last year, and I'm really curious what you and other partners come up with solutions this year. Yeah, here are some examples. I guess you can all see it, that they're made from paper or just beads and chilies and even balloons. Next slide. To make it really easy for you, there's a video. There are some paper template for paper bracelets that you can just download, cut out and color in. And if that is even too complicated, we have some digital bracelets like PNG images or animated GIFs that you can just put on your own photo, and then it looks like you're wearing the bracelet, and then you post it. And those are available for download, but also in Instagram for the stories. Next slide. What we've seen is that the bracelet works really well in this kind of four different areas. So yeah, engage your country office colleagues. And here we have an example from GIZ last year, who set themselves a challenge to reach 100 staff with taking a picture with any kind of bracelet, and they really managed. This year they gave themselves a slightly other challenge, that they want to find 28 countries. So yeah, that was really a fun exercise. In line with that, of course, it's also a great tool to engage your leadership. Like here, the regional director of UNFPA, but we also have examples from other organizations like WaterAid in Myanmar and so on. What we've seen is, like thirdly, is that the bracelet really works well if you want to work on social media with some of your followers, because it's just an activity that they do. It looks nice, they post a picture and so on. And in case you are able to hold events physically, not online, it's also a nice photo opportunity to create and distribute the bracelet. So that's all very nice. And lastly, it's an amazing tool to engage political decision makers. Of course, that's only an entry point, but simply by a politician like here, Karina Gold from Canada, wearing the bracelet and releasing a statement is already so powerful that you then can follow up and do continued advocacy with them. So yeah, different possibilities, whatever your idea for your events for this year are. Next slide. I have two highlight events that I want to promote. There are surely more, and we have an event entry page on our website that you can also see. So just wanted to share two events that we're hosting. One is on 18th of May, the free streaming of Pandora's Box. It's a documentary shot across the world, in India and Kenya, in Canada and America, highlighting different aspects around menstrual equity, and education and access to products. Yeah, we got a free screening allowance, permission. It's on 18th and the entire 18th. You can watch the film, and then we're going to host a small discussion with Christina Lundberg, Marnie Summers, that you all probably know, and Karine from Diva International, one of the producers. And on the second one is on 28 May. We're going to host another live broadcast from Berlin to really share highlights on what's happening on MH Day. So if you let me know what you're planning for MH Day, maybe you make it into the show as a highlight. So that's a small nugget for you. Next slide. And I think that's already the summary. So yeah, so you have it all on your page. If you haven't subscribed yet, I'll do subscribe to our newsletter. I'll share the link anytime in the chat box afterwards, so you don't miss any of the exciting updates coming along to you in the next, let's say 20 days. Thank you so much.
Thanks so much, Ina and Therese for wonderful and very informative presentations. We'll direct our attention now to the chat box. I don't see that many questions have come in, but we wanted to invite everyone to, you can take yourself off of mute if you have a question, and please ask our speakers. I'll give the floor. And I believe Jackie will go ahead and leave that section. Thanks.
Wonderful. Thanks, Salome. And a big thank you to Ina and Therese. Wonderful, wonderful presentations, very informative. I have a question. If organizations or individuals are interested in getting involved with the Menstrual Collective, how would they do so, and what opportunities might exist?
Thanks very much, Jackie. Yeah, at the moment, it's a very simple membership procedure. First of all, I'll put the website in the chat box, but I'm currently co-coordinator of the collective with Virginia Kamar, who was formerly with WSSCC. And as long as you know, we ask people to kind of confirm that they are they want to contribute towards our mission, and that they are supportive, particularly of human rights and gender rights. And generally, the members that we've had apply are non-controversial, so it's simply a matter of sending us an email to express an interest in joining, to indicate perhaps which areas of our work you're most interested in, and also to provide like one key focal person as a contact within the organization. So most of our members are representing organizations, but we do have a few individual members. What I would stress is that as a collective, we're really focusing our attention at a sort of global level. We are also addressing kind of national level investment, but that's primarily through our members who have their own programs and initiatives at national level. So we see ourselves as kind of connecting to those through our members. We generally don't kind of undertake national level initiatives ourselves. So the simple answer is send me an email. We will be sort of formalizing our processes in this year. But that's the key thing for now. And then based on interests, we'll be sharing our kind of plans around activities coming up that members can join in. And then there are also the action groups that people could join. And at the moment, those are around advocacy, research. We have a humanitarian action group. And then there are a few more likely to be initiated this year around specific short-term tasks. So assessing the investment baseline at the moment, and also this private sector scoping as well.
Wonderful. Thank you so much, Therese. Great. I think we're starting to see some questions coming in. So there's a question, is Nigeria featured in the documentary? Is Global Menstrual Collective working in Nigeria presently? And if yes, can you give a brief information on its activities?
Related to the documentary, no, it's not featured. I think it's no, not that I know of. I can say, like, Nigeria is now country number 2 or 3 in our MHJ partnership. We have so many partners in Nigeria, so it's really it actually could have their own feature. Related to GMC, I'll let Therese answer.
Yeah, I mean, I think I covered it a little bit in my previous answer, which is that we don't work directly at the national level, and currently, currently I think as well through our members, we're not connecting directly to initiatives in Nigeria, but I would say that that's a kind of relatively new way of thinking that will be developing under the new strategy. So far, a lot of our attention has been towards this kind of knowledge processes like the evidence gaps assessment, and the consultation around defining menstrual health, and working towards advocacy at global conferences and platforms like Generation Equality. And previously we did sessions at the International Conference on Population and Development. So at presently, no is the answer, but we're looking to strengthen how we connect to national level under this new strategy.
Thanks, Therese. And I see that Ina has mentioned that there's a number of partners celebrating MH Day in Nigeria. So Ina, could you just maybe remind people where to go for information that maybe might be country specific for MH Day, or how to find that out?
They should contact me. So we have a list of partners, but they're not sorted by countries. If you want to see what's happening, there's an event page. And if you want to connect and let me know, you just write me an email. I'm happy to connect. I think that works the best. If there is a coalition, for example, in Nigeria, happy to coordinate through the coalition. I'm not aware that there's one. And we have a lot of also very small partners in very remote villages, but I think Nigeria is ready for better coordination, I would say, because there's so many partners working on it.
Great. That sounds like an opportunity.
Yeah, absolutely. And for example, the infographic I shared, that's a global one, but we could also imagine that this can be adapted. Thank you, Salome, for skipping. I think 3 slides ahead. That's a global roadmap, but we could also imagine, this one, that this can be then tailored to country level. So where you highlight then your country level progress. Maybe not for this year, but using it as a national infographic.
Great, thank you. I see another question we have from Doug McCall, thanking everyone for the presentations. And his question is, could you elaborate on the consultations with donors? I think we need to better understand their needs and concerns as we try to persuade them to make longer term commitments.
Yeah, thank you, Doug, for this question. And I think that has been also one of our key learnings in the process. So initially, we really wanted to invite the donors into the broader consultation with all stakeholders. And then we found that the existing donors are sometimes a bit uncomfortable because it's either past commitments or it's existing commitment, but not, there's no really focal person for it. So yeah, it has been really more challenging than we thought. So then we shifted the approach to talk with them bilaterally, and they were much more comfortable to speak. We have distilled a few of their reasons why they invest into the investment report. And as I said, it can diff, as I said before, what we figured is that their needs can differ very widely depending on where they come from and where they situated it. It's again a challenge for them that MHH is so cross-sectoral that they don't find necessarily also coordination within their own donor organization or elite, and then it's like led by, like, let's say the wash sector, and then but it's not really well. So coordination is a real challenge. Their biggest concern, so the concern was really interesting. So the concern, of course, most of them said, like, we don't have enough evidence. And I think we all acknowledge that. But there were also still a few that said, well, we're happy to support the evidence generation. For us, it's really clear that it's a matter of rights. And we know that women and girls have challenges and suffer. So we found very mixed feedback, but in general, the needs were around that. Some of them also expressed that they would found it very useful to have kind of comparable costs. What would something cost like? But then this is really difficult because it can be so context specific and approach specific that we then abstained for using really costed examples into something. Although, for example, I know like the World Bank is now working on a programming guidance, and I think that's really something that a lot of donors are looking forward to. I hope that answered your questions, Doug.
Great, thank you, Ina. So I don't see any other questions in the chat box. Sorry. Is the term MHM not used by WASH United and related organizations anymore? I think some government documents still use MHM. That's a question from Ellie Sugita.
Maybe I answer first, and then maybe also Therese can answer based on WaterAid and Global Menstrual Collective. So I think we're still, so we shifted to menstrual health and hygiene to be a bit more encompassing. I don't mind if there's still the term if governments still use the term MHM, I don't mind at all. I think especially because if governments are using the term, they know what it means. I mean, meaning that all the different components are part of the menstrual hygiene management solutions. So then it's totally fine. When we use menstrual health and hygiene, we mean menstrual health. Menstrual hygiene management, menstrual hygiene management plus some systemic factors, with now the menstrual health definition being there. We might see a shift in language also from our end. But for this year, we stick to menstrual hygiene and menstrual health and hygiene as a term. But it's okay to use menstrual hygiene management. I think it's, if governments are glad with it, let's not get necessarily back down in terminologies when it's clear what they want to work on. It's my take.
Yeah, I mean, I completely agree. I think the purpose of expanding the terminology was really to just acknowledge that firstly, the term menstrual health is being used by quite a lot of actors, but without there being a kind of consistent and coherent definition that was based in experience and evidence, as I was saying at the beginning, and also to kind of acknowledge that for some actors that is a preferred term, and menstrual hygiene management, when it was defined, was for a really specific purpose around the advocacy towards incorporating menstrual hygiene within the SDGs, and particularly by the WASH sector. And that's what I meant by it. It's starting out as quite a narrow definition, because it was you know, it has a definition around using clean materials, changing them in privacy, having access to water and soap, and being able to wash the body as frequently as required during menstruation and disposal. And it had this additional component of education, knowledge as well. But obviously, programming that goes under the term MHM is often much more expanded and comprehensive. But at the same time, some people seeing that definition, and particularly those coming from the health sector, looking to address more reproductive health issues related to menstruation, and others felt that it was kind of, you know, it didn't create space for them and for their responsibilities. So providing a definition of menstrual health, we hope, you know, really just brings more actors to the issue, and expands the opportunities for people to engage and to address, as I said, the comprehensive menstrual related needs that we have seen through evidence and programming.
Great. Thanks, Therese. Well, we're at time, so I'm going to wrap up. But a huge thank you to Therese and Ina for your presentations today. And I want to thank all of our participants for your attention and your engagement today. Please do watch out for our next webinar. We will have one coming up in October, and the invitation, including a list of speakers, will be forthcoming. And as always, this recording, as well as previous recordings to FRESH webinars, will be available on the Save the Children Resource Center site, the FRESH Partners site, and UNESCO's HIV and Health Education Clearinghouse site. And if you have any questions at all, please email us at fresh@savechildren.org. And thank you again for your time, and have a really wonderful day.